I'm very glad to take this opportunity to give this testimonial because of the almost complete opposites of what I expected when I came over here. The stereotypes that I learned in the 1950s, what I learned in what I have seen in my hometowns are altogether foreign now. So I had no other place to go, so that's the reason I'm here, because my own country would not take care of me. But more so than what my own country failed to do, you made it possible. And I want to thank some of the people. First, I want to thank God and my Savior Jesus Christ, and the people who worked with me to get me here. And I want to thank the staff here, not just the surgeons, but everybody. It has been an experience that is really, I couldn't describe it on this short tape you're going to make here. The surgeons took care of me extremely well. I could go home right now. I feel that good. 6 days from a triple vascular bypass, right? And of course, they're making sure that I don't, take any extra liberties and get out of town early. But at every question I had, every need I had, the surgeons were there. Nothing they told me was not the truth and was not what happened. But more than that, from my own perspective of comfort, your staff, your nurses, the housekeeping guys and girls, just phenomenal. There's a work ethic here that I have never seen before. And the system you used in an ICU, which other people like me will wind up, will also experience, is a whole lot different than ours in the States. And let me say that when you're in pain and you've had a surgery that you don't know much about, and you wake up and you're scared, or you're in extreme pain, there was somebody there just maybe to put their hand on you. And you have no idea how comforting that was. And they were not low qualified people. They took care of every task with perfection. And I couldn't tell you enough about it right now. That would take, like I say, more than you have here. And I'm very thankful for Max Hart. I found you on the internet. Hopefully you will get this word out. I want this word to come out to my fellow Americans that are in the same position I am, where I cannot afford insurance. Even if I sell everything I had, I could not have had this procedure done. So if there's anything I can ever do to repay this, the cost was phenomenally low, and the care was phenomenally high.